Namaste India. I am Dr. Nupur Krishnan, clinical nutritionist, Fit India ambassador. Today we are at war against COVID. It is a unique war. We cannot destroy the enemy, but we have been fighting with vaccines and medicines. However, today we are going to discuss about third armor in our fight against COVID. That is the role of nutrition in fighting COVID. Will nutrition therapy replace medicines? Certainly not. But nutrition therapy will supplement the efforts of medical practitioners and help to reduce their burden. Let us analyze the situation. The speed and ease at which COVID spreads puts a very huge burden on our healthcare professionals, healthcare infrastructures and resources like medical oxygen, ventilators, ICU beds, medicine and medical equipment, etc. The purpose of nutrition therapy is to make people healthy through their own food and reduce their requirement for hospitalization. Hence, it will reduce the burden on healthcare professionals too. Since we have vaccine, is it necessary to have healthy diet? Let's see how a vaccine functions. Many people think vaccine is a chemical which can kill coronavirus. No, it's not like that. A vaccine basically prepares our immune system to identify a virus and destroy with antibodies. Our immune system is strengthened by the vitamins and minerals. So if our immune system is weak, even with vaccines, we cannot fight against virus effectively. Some of you may be in home quarantine or hospitalized or not infected. But the following guidelines will help you and your family to remain safe. The primary objective of this talk is to create awareness about what is going to happen in case if you are infected with COVID, and how to prepare well in advance so that you recover fast with lesser complications. Well, how does COVID attack us and what are the complications of COVID-19? COVID is a coronavirus disease causing SARS, severe acute respiratory syndrome. We all know that our body organs need oxygen and lungs supply oxygen through blood and extract carbon dioxide from blood. In simple terms, COVID causes inflammation in lungs and accumulates fluids inside the lungs. It prevents the inhaled oxygen getting into blood, hence drastically reduces oxygen level in blood and increases carbon dioxide in blood. This leads to conditions like pneumonia and SIRS, systematic inflammatory response syndrome. Due to low oxygen levels in blood, our other body organs like lungs, liver, kidney, intestine are damaged, which leads to death. Myocardial failure also happens, which leads to heart failure. We call this condition as MODS, multiple organ dysfunction syndrome. The other problems are, number one, asymptomatic. It spreads in stealth mode where the symptoms are not visible until COVID seriously affected our body. Number two, coronavirus is adapting to changes and emerges in new avatars. So the tasks in front of us are, number one, how to increase oxygen supply. Number two, how to protect the lungs and other organs. And number three, how to make our lungs healthy and improve lung functions. So, who are the high risk people? If we look into the data, 95% of the people died are above 45 years of age. People having weaker immune system and suffering from other ailments like diabetes, heart problem, high blood pressure, lung function and kidney problems. We call them as a comorbid patient or high risk patients. As we can see from the graph, as age increases, the risk factor also increases. What is the role of nutrition therapy? Let me explain how nutrition therapy works for COVID patients. The salient feature of nutrition therapies are: number 1, improve fighting mechanism of cells by improving your immunity in advance. Number 2, prepares your body organs fully loaded with adequate nutrients. Number 3, your health is maintained by the food you consume, which is natural. Number 4, does not involve any additional cost or efforts to stay healthy. Number 5, prevent chronic diseases like diabetes, obesity, high cholesterol, high blood pressure, lung infection, liver and kidney problems. And number 6, a treatment which can be administered at home without need to get admitted in hospital. In simple terms, it simply helps you to strengthen your immunity, to improve functioning of organs, minimize the damage to organs, to recover faster, increases chances of survival much higher. It reduces your medical expenses, and remember, it reduces your physical and mental stress too. Let's see how COVID nutrition therapy functions inside our body. It improves oxygen level in blood. Number 2, maintain adequate level of nutrient. Number 3, supplies sufficient energy. Number 4, preserve lean body mass. Number 5, strengthen respiratory muscles mass. Number 6, repairs and replace damaged cells faster. Number 7, maintain fluid balance. Number 8, improves resistance to infection. Number 9, excrete of toxin waste. And number 10, reduce the oxidative stress caused during immune system fighting against COVID. And number 11, and the last, helps body organs to respond faster to the medication. Now, how to handle or improve low oxygen levels? One way is to artificially increase oxygen supply through ventilators, and the other way is to improve the function of lungs. The other interesting methodology is by improving oxygen carrying capacity of blood. How is it possible? 98% of oxygen in our blood is carried by hemoglobin. If we improve hemoglobin level, it helps our blood to carry more oxygen to all body parts efficiently and remove carbon dioxide from blood. Hence, it prevents damage to other body organs. To increase hemoglobin level, consume high protein and iron rich foods. Let's see, what are the iron rich foods? Traditional lentil horse gram, commonly we call it as kulthi. Our forefathers consumed this protein iron rich packed lentil frequently to cure kidney stone, gout, liver and diabetes too. We can consume kulthi in different ways like kulthi soup, kulthi dal, kulthi snack, kulthi thepla. Apart from kulthi, the other iron sources are lotus seeds known as makhana. When we roast lotus seeds, it's pop up as a makhana, as you do for the corns, popcorns. Lotus stem sabji, jaggery and black sesame seeds. You can have as a black till jaggery laddus, dates, bhuna chana, kurmura, liver soup, egg, halim, which we can commonly call garden cress seed, poha. Even though spinach is rich in iron, it contains phytate and oxalate, which prevents absorption of iron. Always remember that our body will absorb iron when eaten with vitamin C rich foods. So try to consume iron rich food along with vitamin C sources. A perfect recipe of iron and vitamin C combination is poha with black till, with peanut and lemon. So this is yummy recipe and very good combination of iron and vitamin C. How to protect our lungs and improve lung functions. The most important defense mechanism in lungs is ELF, epithelial lining fluid or mucus, which act as first level of protection. It sticks and excrete pollutant, virus, bacteria, free radicals and prevent them from entering in our body. But when our body continuously fights against COVID, excess mucus is produced which affects lung function. If you want to clear mucus, start consuming food like horseradish, parsley soup, celery soup, lemon, garlic, Indian cherries, we call it lasoda or gonda. Take steam inhalation with eucalyptus oil regularly, that also be very effective. Due to malnutrition, our respiratory muscle mass is reduced and lungs become weaker. It is more prone for inflammation, loses its elasticity to inhale and exhale effectively. Due to increased catabolism, you are also likely to lose your muscle mass rapidly. Breaking down of muscle mass depletes potassium, phosphorus, calcium and magnesium, which will reduce your lung functions. So you should consume food rich in these minerals so that even if you are infected with COVID, you have adequate levels to compensate the loss. Consume foods like rich in vitamin A, vitamin C, magnesium, zinc and good quality protein to protect your lungs and reduce inflammation. Our body produces a lot of ROS, reactive oxygen species like hydrogen peroxide, nitric oxide, hydrochloride, which we commonly call as a free radicals. And free radicals severely damage our cells. To neutralize free radical toxins, we shall consume more antioxidants. Now let me tell you about natural antioxidant sources. Vitamin A plays a significant role in repairing damaged cells and boosting immunity. It is available in all type of colorful fruits and vegetables. Capsicum, pumpkin, mango, apple, apricot, papaya, sweet potatoes, carrot, non-veg food items like turkey, egg, chicken, paya soup. Various studies suggest bioavailability of these vegetables is limited, which means if we consume in raw form, vitamin will not be absorbed by the body. So what to do? Cook them. Next time, if you are consuming carrot and tomato, cook it for their proper absorption in the body. Next is vitamin C. Vitamin C rich foods are known as a lung friendly foods. Rich sources are gooseberries, commonly you know amla, peru, guava, lemon and all types of citrus fruit, mandarin, tangerine, different type of grapefruit, pomelo, all type of citrus fruits, pepper, tomatoes, broccoli, spinach, cabbage, potatoes, mango, papaya, berries, blueberries, raspberries, all. Now, let me tell you about vitamin D. It acts as an antioxidant as well as improving calcium and phosphate absorption, which is good for your bone and immune system. Vitamin D is available in all type of seafoods, fish oil, milk, curd, paneer, egg, butter, even pure ghee. You can take vitamin D supplement also. Now, let me tell you next antioxidant, vitamin E. Vitamin E is most important antioxidant and plays a significant role in protecting body cells against free radical toxins. Rich sources are dry fruits like almonds, walnut, peanut, edible seeds like flax seeds, sunflower seeds, sesame seed, pumpkin seed. So if you can consume 1 teaspoon of edible seeds and fistful dry fruit, it will provide adequate zinc, manganese and magnesium. Let me tell you one more important nature of vitamins. Vitamin A, D, E, K are fat soluble vitamins. So they are stored in our body and utilized whenever it is required. However, vitamin C and B complex are water soluble vitamins and they are not stored in body because they are excreted through urine and sweat daily. Hence, we must consume sufficient quantity regularly as per our requirement. At the end of the talk, I will be explaining you sample menu plan for COVID patient. But before that, I would like to highlight few more points. When you have high fever, you will face the following conditions. Number 1, loss of appetite. Number 2, bitterness in mouth. Number 3, weak digestion with acidity, bloating and burping. And number 4, body weakness. So, due to high fever and consumption of medicine, you will feel bitterness. Not only the food, but even drinking water will taste bitter. Because of this, you tend to eat less food and your energy requirements are not fully met. You will lose muscle mass, hemoglobin and feel weakness. Due to this, oxygen levels will also decrease and you will feel breathlessness. One simple but very effective way of increasing food intake is by cleaning your tongue twice a day and gargle with betadine or salt water. It will reduce bitterness in taste buds. Try to have tomato rasam, liver soup, pepper soup, raw mango, aam ka panna as an appetizer. They are also packed with natural powerful antioxidants and taste better than bitter kadhas. Avoid fried food and heavy non-veg food items and try to eat light food items. Consume more succulent fruits and vegetables like watermelon, mashmelon, mango, pumpkin, bottle gourd, ridge gourd, wood apple. We commonly call it as a bale fruit. It's very nutritious fruit. Instead of drinking plain water, try to have water with nutrients, for example, aam ka panna, sattu, fresh bale pulp drink, vegetable kanji, buttermilk, charge, lassi you can have. A caution, drink only sufficient amount of water to prevent water retention or edema problem. Do breathing exercise, spirometer. If you don't have a spirometer, inflate medium-sized balloon 10 to 15 times. Sleep well to boost the recovery process. Now let me reveal a sample COVID diet plan which you can easily follow at home. Early morning, you can start with coconut water with jeera, or you can have fresh lemon tea, no ready-made tea bags please. Fresh black tea, ginger tea. You can add honey, mint, lemongrass in tea as per your taste. Now, pre-breakfast, any seasonal fruits like mango, watermelon, mashmelon, papaya, wood apple. Breakfast, vegetarian can have idli, dosa, poha, boiled rice kanji. Non-vegetarian can have poached boiled egg, scrambled egg or egg chila. You can add flour with egg and you can make omelette out of that. 5 to 10 numbers walnut, almonds, apricot, dates, fig, fistful peanuts or flaxseed. Mid-morning you can have raw mango, aam ka panna, buttermilk, charge or vegetable kanji or coconut water also be the option. Lunch, you can start with tomato rasam, chapati, rice, pulses, vegetable sabji as mentioned earlier. Now evening, you can have bhuna chana, kurmura, bhel, black tea, fresh lemon tea, aam ka panna, chikki jaggery peanuts, sesame laddu, black til laddu. Avoid eating any sweet dishes or fruits immediately after meals. These will increase the glycemic load and can lead to diabetes. Pre-dinner, you can have kulti soup, drumstick soup, tomato soup. Dinner, you can have dal khichdi, chapati, rice with above mentioned vegetables and 4-6 green olives also you can have. I give you a very nutritious secret recipe. So you don't need any multivitamin tablets. It is green chutney, fresh green chutney, made with coriander leaves, mint, ginger, turmeric root, raw mango and black salt. You can pour lemon also. Mint acts as an appetizer. Black salt and ginger will improve your digestion. Coriander, mint, ginger, raw mango and turmeric root will provide you micronutrients. For more information, please visit my website www.biologics24.com, biologics24.com, or you can Google my name, Dr. Nupur Krishnan. I salute all frontline warriors for leading from front. This war cannot be won by going out to destroy the enemy. It is won by staying safe and healthy. Stay healthy and stay safe. Jai Hind.